was on our
Meeting
call.
recording has started.
Sally,
So
would you like to add something?
Yeah, so thank you, Hamza, for doing this. Thank you, Ivan, for taking your time. So, Ivan, this is a continuation to what Dave presented, and the goal of this is to come back to us with one win kit that includes all solutions addressed to the healthcare vertical, and how our partners and our customers can benefit from this. So we're not developing two different WinKits. We're developing one Avaya Healthcare WinKit that includes everything.
Okay, got it. Thank you.
Okay. Ivan, thank you for joining the call today. My name is Hamza Al-Wahbani. I'm handling the mid-market in MEA Turkey. And today I'm going to take you through the healthcare solutions, applications which we propose for our mid-market and SMB customers. I will jump on this slide because this slide will give you an idea about Avaya, a leading provider of communication-based solutions for CC, for healthcare, for how many years, and I will go to the agenda. During today my presentation, I will talk about the healthcare challenge and what we can help in that, and how we can integrate our healthcare application solutions with the customer attached with our telephony system, IB Office and contact center, ACR or ACCS. And as well as I will give you an idea about what the patient before he goes to the hospital, what he needs, what we can propose him, what is the solution, what are the solutions where we can help him to do activities before goes to the hospital, and as well as during the during his stay in the hospital, what kind of services, solutions, applications we can provide there. And as well as after leaving the hospital at home, what kind of solutions we can offer for the hospital and for him. And at the end, I will go through one case study, and with our healthcare references in mid-market. That's my agenda today. So in healthcare today, there is a lot of challenge and needs for most of the healthcare sectors today, and we will see how we can address this challenge and how we can address these needs for the mid-market customers through our healthcare solutions and application. Today, from the challenge and in the healthcare, how the healthcare sector can maximize utilization of the doctors and other resources, how we can gather all these and communicate, simplify the communication between all of them, as well as locating and reach to any staff from anywhere, from any device. That's the challenge. We can solve that and we can address that challenge, as well as missing out communication from digital channel. Today, still most of the healthcare supporting just the voice and some of them, some of the digital channel, but how we can address all, bring all the digital channels to the patient, to the doctor, to the staff, to the employee, how we can simplify the communication through all these digital channels, as well as also gathering relevant experts and staff most efficiently as the time of urgent needs. By any time we can reach to any expert, to any consultant, to have them on the call, to get details from him, as well as today in the one of the challenge is no tracking for internal case delegations that we will going to address, as well as the collaboration with external specialists or healthcare provider through audio or video or digital channel or video conference. Handle all the calls efficiently to not maximize the patient intake. That's how we can do and make the call very fast and bring all the details to that call with our integration with the back-end systems, as well as the remote consultation, managing patient data and making it available on the call automatically. That's what we are going to address, and manage and track the ambulance car or fleet of the vehicle. We have some applications to manage and track that cars. The last thing at the end, how we can obtain the feedback on the patient specification. All these challenges and needs going to be addressed by the mid-market healthcare solutions by Avaya today, and I'm going to take you through all of that. So before going to the hospital, it's easy. How does your hospital provide remote patient video communication? How will your remote video solutions integrate to existing workflow? How we can handle the patient appointment through digital channel, how we can handle the chatting with patient or calling through different channels that we are going to handle today. We'll show you during the hospital visit, what is your mobility strategy of your hospital clinic staff that we are going to address through our application. Will you offer in-room video service for the patient to communicate with family? Yes, that's what we have today. And how does your hospital provide front desk attendance service for automation, for help quickly, for do an appointment through IVR, a lot of services on front desk attendance services. So at the end, after the hospital, after the patient leave the hospital, how can your patient communicate and engage with different channels? How as well as are you planning to use social media channel for patient chat and messaging? At the end, how we can get and monitor and get survey, let the patient to conduct survey and know the feedback after visit, after finish the visit to the hospital. So how can Avaya address all of that? Starting from the digital communication, going through the communication in the staff, going to the appointment, to the integration with database, and ending with conduct survey. Yes, today we have a lot of applications. We have value-add applications. But before that, our mid-market core will be the IB Office, which is the telephony system, which is the contact center, which is the video conference coming with it. And around that, before that, our IB Office telephony system contact center can be deployed on-premise or it can be deployed on cloud. And around our core telephony system and contact center, we have value-add applications like the callback, the SMS, the customer survey. We are going to talk how we can address these applications, how we can propose to address the challenge of the healthcare, like the chatbot, the dialer, the WhatsApp connector, the social media, the click-to-call, the CRM, and the case management. All these applications, we are going to give a case study how we can use them to address the challenge of the healthcare, to simplify the process of communication between doctors and resources and the contact center agent and the customer, and how we can enhance the healthcare services, how we can make the customer happy, the patient happy, and how we can make the hospital more professional in terms of services. So in healthcare solutions, first of all, we are allowing all the patients to go to the different platform of the social media, start chatting with the healthcare organization to ask for something, to chat with agent. And not only that, we are enabling the chatbot on social media on website, on Twitter, so that chatbot can reply to the most questions which most of the patient always asking. Not only that, we are enabling the chatbot on the social media or website, Twitter, Facebook, to do an appointment. So the patient can go to the social media and book appointment with chatbot without talking to the agent, and he can go to the confirmation, and that confirmation will go to the hospital system, and all will know. As well as we are allowing on the website a button so the patient can click on that button to call agent without remembering what's the landline number. Just one, if any patient looking in the website or in the social media for some details and he wants to talk to the agent, he can click button and call direct voice call without landline. Okay, and without SIM gateway to call. That's the click to call. As well as all the missed calls coming to the agent, to the hospital, we have an application to call them back if we missed them, or if they call after working time hours sometimes, or if all the agent is busy, we can give the agent option to press a button and we will call him back. That's the callback assist will help the customers we will help the hospital to not miss any call. As well as at the end, when the patient reach to the hospital, we have our Avaya contact center where the agent can answer the calls, reply to the chat, reply to the emails, and getting full reporting and communicate with with patients through this contact center with full reporting, real-time dashboard applications. As well as when the call come from the landline or chat come from any social media or email come to that agent, we are not allowing the agent to go manual and search about the profile of that caller. We have the CRM connector where this CRM connector, this application will bring all the customer profile, will bring all the patient details automatically in front of the agent. So the agent will know who is calling before answering him. The agent will know who is chatting before reply to him, because automatic pop-up screen with web interface will open automatically to show all the details of that patient. So if that patient has, for example, an appointment, he will know that he will ask about the appointment, or he will change the appointment, and he can edit that informations, and this edit will be synchronized with hospital system. That kind of simplify the patient will not lose his time to explain to define himself, to tell himself. He will not repeat himself when he called to the hospital. I am Hamza Al-Wahbani, I want, I have an appointment. No, we are making automation of getting all these details in pop-up screen in web portal in front of the agent. Okay, as well as we have an appointment system, so the agent can enter all the appointments, edit all the appointments of who is calling or chatting, and that appointment system, once finished, will be connected to the SMS gateway to send the patient the confirmation. Not only that, the appointment system will send SMS as a reminder or reschedule for these patients. So all the agents will have the full access, the full details about where he can book the appointment. He has the whole schedule for every doctor, for every department. Then there is no human errors, and the customer will be happy. The customer will come on the time, and we will not lose the customer because we have SMS gateway to remind him, to send him and reschedule or confirm you are going to come. So everything on track in terms of appointments and in terms of reminders. As well as between the staff, between the doctors, between the hospital or healthcare organizations, we are using the Avaya Econex applications which will allow them to do a video call or audio call between the staff, between doctor to doctor, between that will make them to collaborate, to engage even remotely. This application will enable reaching to any doctor, to any staff remotely at any time by using any device, no matter where is now in this matter. As well as this Econex application will allow to make a video call for help, for consulting, to do kind of operations. Okay, as well as this application will allow the customers when the patients, when they call, they can reach to any doctor if they know his extensions, even if that doctor today not going to the hospital or he's locating remotely, the patients can reach to that doctor anywhere, because we are using this application on their mobile, their PC, and they can use it remotely from anywhere. At the end of this journey, after the patient leave the hospital, we can let the patient conduct a survey. That survey can be after call, or it can be through the chat. If the customer came from the chat, from the social media, after finish, we can send them a link to conduct a survey. If he is on the call, we will let them to after finish the call to conduct a survey, to give his opinion about the services, to get his feedback. Not only that, we can send him SMS or email after he finish to conduct a survey. So this kind of survey will allow the hospital, will allow the healthcare organization to enhance the services, to know the opinion of that customer, to develop the business that will make the patient is happy and the healthcare sector or organization more professional. So from the social media, we are allowing the customers to communicate, to book appointment, to get, to ask, to conduct with agent easily. That's the social media with chatbot. A new customer can access social media page anytime to know more about the services. For specific details, he can click on Messenger in any social media and start chat with a live agent, as well as the chatbot will provide customer with required information about available services and provide option to talk to live agent and escalate that kind of chatbot to live agent, as well as the customer gets in touch with agent over web via chat, voice, video, query gets. He can even call him from that button on social media, on website. Additional channel of communication, which is the click to call as well, and the call back, which will allow the customer to click to call, contact with agent through the web, through the social media, and talk to him by the voice, without remembering what's the landline of that hospital, or that landline will be busy, or he will be waiting. He can use the click to call, and if he missed the call, our callback will call him again, as well as as well as we are using our case management, we are using our contact center to address any complaints coming from the customers. So we have the case management where the agent can open a ticket, that ticket can go to the specific department and escalate that ticket, and that case management will give us also pop-up screen. So if the customer who complained one day, for example, and he call again or chat again to the contact center, pop-up screen will open, and in front of the agent will come all the details of that complaint. So the agent will know why that customer calling, because still the issue not solved it, or we need more escalation. Okay. as well as the CRM connector will improve the surface more, because without CRM connector, without integration between the voice, between the chat, between the patient, without integration that who is lookout, okay, without integration, the voice call, the chat coming from the social media, from website with hospital management system, a lot of wasting time will be there. So imagine if the customer now call to the hospital and there is no kind of integration with hospital management system, with any CRM. What the patient will do, he will start getting questions from the agent. What's your name? What's your mobile number? What's your ID? What do you want? You are a patient with us or no? And if the call disconnect, the patient will call again and he will repeat himself many times, as well as once the agent take all the informations from the patient, he will start manually searching in the hospital management system about his details, his appointment, and maybe during that time a lot of mistakes and human errors will be happening. So maybe then wasting time, human errors, customer repeating himself, customer not happy. That why we Avaya can address these problems by the CRM connector. So the CRM connector will get all the customer details, all the customer profile automatically in front of the agent once the call come or chat come from any social media or website. No, in that time the agent will know who is chatting, who is calling before answering him. The patient will not repeat himself, will not talk about himself. The agent will address his question quickly. That means we can address a lot of customers, more customers with short time. That will increase the revenue for any healthcare sector. With appointment as well, that can that make all the appointments in track. That kind of appointment system will manage all the patients, will remind all the patients, so every customer can come to the appointment on the time, because we have a system to remind him or to reschedule him. Imagine healthcare without appointment system. Automatically, what will happen? A lot of problem. First of all, maybe two agents will book the same doctor, same time to the same to different patients. That kind of error without appointment system. Not only that, if the healthcare not provide SMS to send a reminder or to send a reschedule or confirm, then maybe our resources of doctor will be allocated and no patient come. That kind of money wasting. So we are investing in our doctors, in our resource, in our hospitals, but no one send a reminder for the patient to come. That wasting of money. Lot of problems, but with our appointment system, we can increase the revenue, we can utilize our resources and doctor, and we can guarantee the return of investment by bringing all the patients to the slot time by the time. Okay, as well as we can use our Econex application, our Avaya space, our video or conference solutions to get a remote consultation. So we can get remote consultation. We can do a conference call with external doctors, with another doctors, or with consultation to address the patient problem. So consultation can be conducted in a small room with a video camera. Patient or remote consultants use a PC or tablet to attend the consultation. Operations, etc., can be also showing via web or larger audience. For training sessions can be recorded and saved for later references. So these kind of recording sessions will help the hospital to improve kind of operations or kind of training or kind of services for the customers. Not only that, if we don't have resources from one healthcare organization, we can use our Econex Avaya space to get external consultation to the same operation, to the same services with a small charge of cost instead of having all the doctors working for the same hospital. This kind of service will allow doctors to be shared between multiple health cares if we have a short list of doctors. So we can bring any external consultation or any external doctor from different branches, from different organizations to the same operation, to the same service by our video conference, Avaya Space, Econex conference applications to do that, to deliver that. That will increase the revenue. Finally, our customer survey can measure the patient satisfaction. After the patient leave the hospital or finish the chat or finish the call, he will get a link or he will get a call, he will get SMS or he will get email to conduct survey. So this kind of survey will allow us, will allow us to know the voice of the customer, the feedback of the customer. That will allow the healthcare to enhance the service and to bring more resources if required, or to enhance the environment of the hospital. Let me give you a case study, what we did for American Hospital in Dubai. In American Hospital in Dubai, before we meet the customer, in that hospital, the customer had only one kind of communication, which is the landline. If they need to book an appointment, they should call or walk to that hospital. And a lot of waiting and missing calls was there. On that time, the customer cannot book appointment or chat with agent or reach to the hospital through any other digital channel, through for example, social media or website, and there is no like automatic appointment used by the chatbot on that time. Not only that, because there is a lot of branches there, the kind of communication between the staff was not good in that time. There was a lot of missed calls. There was sometimes the patient cannot reach to some branch, cannot reach to the specific doctors if he is not in sitting in his desk, and missing out of communication from different digital channels, as well as after the patient leave the hospital or finish the call, there was no tools to evaluate the customer feedback and satisfaction. All of that, as well as when the customer calling or coming from calling the hospital, there was no customer profile identification integration. So the agent on that time asking the patient, what's your name, what's your ID, to start search manual in the database and look to the patient profile. That was the situation of American Hospital. And when we met them, we start propose for them our mid-market healthcare kit, which was include the new flexible channel website, Facebook, Twitter, chatbot, and allow the patient to start texting with agent, chatting with agent, getting some answers, some information from the chatbot, as well as making communication through all the digital channels, starting from voice, from email, from SMS, from social media, Facebook, Twitter, Instagram, and as well as WhatsApp, okay, and SMS. As well as we enabled our contact center agent, so the agent of the hospital, they have one interface, and through that interface they are answering the voice call, they are answering the call coming from the website, click to call, they are replying to all kinds of chats coming from the website, coming from the social media, coming from the SMS, coming from the email. So one interface for the agents to reply, to conduct with customer at the same time. Not only that, before the patient call the agent, all the details of that agents will automatically open it in front of the agents. That will make the agent more professional to answer the patient, and the patient will be happy. There is no waste of time. As well as we enable the appointment schedule application on the American hospital. So we enable the appointment schedule on for two kind of services through the agent. So if the customer call or chat with agent, the agent will use appointment schedule tool, and we enable the appointment schedule through the social media and the website through the chatbot to be automatic. So patient can go to the website or social media to book appointment without talking to the agent automatically. And we enabled notify patient and the staff, and we enabled the callback assist for all the missed calls, and we enable as well as option for the patient. If you don't want to wait, just click, for example, X button, and we will call you back. And at the end, also, we enable our customer survey application. We measure the improved patient services satisfaction, receiving feedback through multiple channels. If the customer came from social media, after he finish, he will get a survey. If he call, after the call, he will start conduct survey. If he visit the hospital, we will send him email or SMS to conduct a survey. That will maintain hospital brand reputation and modern reputation. That, as well as at the end, what's American hospital today enable additional revenue stream, because before his revenue coming only from the voice, but his revenue today coming from social media, Facebook, Twitter, website, WhatsApp, increasing the number of booking, increasing the number of appointment. Instead of allowing only human agent to book appointment, we allow the chatbot on social media to book appointment. Then 20% increase in booking, that make more revenue. As well as American hospital today has enabled end-to-end process driving case tracing. So the case, due to which they have reduced the operation overhead, case be automated, escalated. By implementing our customer satisfaction survey, the American hospital has taken feedbacks from the patients and improved their internal process, which lead to increase the revenue in their hospital where they implemented changes. Because before, when you are not listening to your customer, you don't know if they are happy or if they are not satisfied. But when you know their feedback, you will go back internally and improve your services, and that will make will increase your brand reputation, and will make the customer happy, and that will increase the revenue. We have a lot of healthcare customers. Just here, I will mention some of them, like Ministry of Health in Saudi Arabia, like King Abdullah Medical City. We implemented this kind of solutions. We have Al-Zahra Hospital, Living Gods in different countries. We have Emirat Hospital Group. We implemented for them our mid-market healthcare. This is our healthcare references. What's the key point here in our healthcare solutions? Number one, increase we increase the doctor time. So instead of wasting the time of agent and doctor with traditional channel, this kind of channel will increase their time, and we can utilize them more. Number two, we can enhance the patient satisfaction. We can increase the customer who is happy. That will increase the revenue. One of the key takeaways from our healthcare solutions, we are enabling quick response to emergency situations. So the patient can reach to the hospital anytime through any digital channel, from the voice, from click to call the website, from social media, from WhatsApp, from email, SMS, and we are making the response very quick. That lead to a new revenue stream through remote consultation, new revenue coming from different channels, and that's as well as improve the fleet management. I forget to tell you about the fleet management. We have an application in a hospital. That application can be used by the healthcare organization, by the hospital, to track the ambulance car. So that applications can be downloaded by the patient, and that application can be downloaded by the staff of the hospital and by the ambulance car. So the patient can go to the mobile application of that hospital and book ambulance car, and he can track the ambulance car until reach to him. Once the ambulance car take them, the hospital can track the ambulance car to prepare the room for him. So that kind of fleet management and booking ambulance car and tracking will improve the service. As well as our healthcare solutions will allow 24/7 customer services, even if there is no human agent, because we can enable the chatbot on social media, on website to answer most of the patient questions, to do appointments without agents, 24 hours by 7 days, without even kind of expenses for that chatbot, one-time payment, and that's it. At the end, we are enhancing all the services of the healthcare sectors, starting from the patient communication, ending to the patient leave the hospital and conduct his feedback and know what's the satisfaction level of that customer. So today our applications can be worked with IB Office, with contact center, with Aura communication solutions as well. And this is the matrix which will show for you the compatibility of our applications. And thank you very much. If you have any question.
Thank you so much. That was very detailed and very helpful. It seems that this has so many different angles and benefits for customers, which are hospitals, I believe. Noura and Shaden, so from the overall presentation, I think it's very detail-oriented.